if you're watching this video and you have heartburn, you will have heard some terms that you don't know or didn't know and did some research on it, such as acid reflux, GERD, Barrett's esophagitis, maybe a hiatal hernia, EOE or eosinophilic esophagitis. You may have been told you have one or all of these conditions. And so I want to make sure that you're clear exactly what these are, because these all relate to heartburn. And it's important to understand the anatomy of this so that you can understand that there's not always just one way to skin a cat, so to speak. Probably not the best analogy, but you know what I mean. There's more than one way to solve a problem with the body. And typically traditional medicine has this is the path, and we're not going to deviate this way, we're not going to deviate this way. This is the path, and don't get off that path. And I'm here to tell you there are other ways to solve this, oftentimes natural ones that work. So let's just talk about anatomy real quick. Here you are, you eat your food, you've got your esophagus, okay? And your food drops down into your stomach, all right? Your stomach has, right above it, almost like a little trampoline, okay? This trampoline is your diaphragm. This is what allows you to breathe. It pulls down to allow air into your lungs, and it pulls back up to push air out so that you exhale out of your lungs. Here's your stomach, okay? So acid reflux are acids here in the stomach building and pushing up into the throat, causing irritation. That becomes acid reflux. It's also known as GERD, G-E-R-D, gastroesophageal reflux disease. Those are one and the same. Acid reflux and GERD are the exact same thing, okay? It's too much acids in the stomach pushing up into the throat, creating pain. When this problem is higher up in the throat, up in here, this is what they call EOE. That's eosinophilic esophagitis. And I do a whole other video simply on EOE by itself. But just be aware that this is a reaction, an allergy reaction in the throat or the esophagus to something. And that is creating this eosinophil count to go high. Okay? The other thing you can have is you can have acids and gas building up here in the stomach, putting pressure on the stomach up into the diaphragm, right? Causing the stomach to bulge up into the diaphragm, okay? And that pressure of the stomach into that diaphragm, it can actually rip through. So then what happens is the diaphragm actually tears. And the stomach pushes up through that ring. So now instead of you having this size of a ring, that ring is now this big. And so now my nose can fit through that hole instead of just my eye, okay? When it gets big like that, now things can start to tear through. And that's what happens with the stomach up against the diaphragm. And that causes what's called hiatal, I'll put it right here, hiatal hernia. You have herniated your stomach through that hiatus, thus called a hiatal hernia, okay? And there's different things that can cause that. That's for another video, but just be aware that these are kind of the basic concerns when you're talking about how to address heartburn. That's what it is. You have GERD, you've got hiatal hernia, you've got EOE, and then what happens when any of these are going on for a long time at the base of the throat, kind of where the stomach and the throat meet, the esophagus, you start to get damage. So then this, kind of the bottom of the esophagus becomes bright, becomes red, becomes painful, it becomes damaged. They call that Barrett's esophagitis. So eosinophilic esophagitis is kind of higher up. Barrett's is right there at the bottom, where these acids are continuously pushing up into the throat, damaging the cells of the lower esophagus, creating scar tissue. That Barrett's esophagitis can then become cancerous. So we'll put that in kind of parentheses next to it. You can develop cancer here in this part when that Barrett's esophagitis is not addressed. You can also get that cancer down in here, right? In the stomach. Due to holes in the stomach, you can also get ulcers that can also develop in here. When there is damage to the lining of the stomach, there's like a mucus layer in there. When that gets damaged, and now you get like a blistering of the stomach lining, that's called an ulcer. That can also happen due to stomach acids being too high. It can also be due to things like H. pylori, which is a bacterial infection. That's another video that we do. So I just want to kind of give you an overall summary of these different things and how it relates to you anatomically, all right? What's most important, if you're watching this video, you are having trouble with heartburn or somebody you know is having trouble with heartburn. This is what we deal with on a daily basis. We helped hundreds of people just within the last year get off of medications related to this, fix their problems that they never thought they could actually fix. And they've been on certain medications or without hope with this problem for years, decades even. And so with this, I can help. And functional medicine is designed to help patients, and in our office specifically, who struggle with heartburn. So in the link to the description for this video, go ahead and go there. Set yourself up with a 15 to 30 minute free call with us. This is what we do. We talk about these things over the phone. We want to know what's going on with you and if you're a good fit for our office. And you can have your questions answered there on that phone call. We can go through it with you and talk about what to expect and what we do. So go ahead and go there, set up that free call. This whatever you're dealing with, whatever the people you know are dealing with, this might be the actual game changer for you. Just setting up this call and moving forward with functional medicine's approach to heartburn versus traditional medicine's approach to heartburn. All right.